Hi, Terry Kuti, and we're here with Dr. Scott Hollenbeck again today. He's with Duke University, and he performs DIEP flaps. So, Dr. Hollenbeck, I have an interesting question. You know, at different facilities, I think patients sometimes go in and maybe a question that they want to ask at their initial consult before surgery. Will there be residents? Will there be fellows in the operating room? Can you address that and maybe give us some vocabulary about what we could ask?
Sure. Thanks, Terry. I think that's one of the most common questions I get. I work at a major academic medical center, so naturally the patients are wondering if there will be trainees involved. And that's usually what we call the residents or trainees. That also includes medical students. So at most major academic centers, there'll be medical students, residents, and even fellows involved in the clinical care of the patients. Medical students are not yet able to take care of patients on their own. Everything they do, 100% basically has to be supervised. Residents in general, they have a graduated process where they start out with very limited number of responsibilities, and as they proceed on to their chief year of residency, they become more and more independent. Finally, there's a fellow, and a fellow is somebody that's dedicating a year to study a specific topic. In this case, we would be talking about microsurgery fellows. And so they're at the very end of their training. They are able to function to some degree on their own, but they're there specifically to learn how to do DIEP flap surgery and other complex surgeries. So when patients ask me, are there going to be residents involved or students involved in my care, you have to tell people the truth, and that is that yes, in fact, residents will be involved, medical students will be involved, and if you have a fellow may be involved in both their surgery as well as their post-operative care. In fact, it's actually necessary because the type of complex surgeries and I would consider that a DIEP flap as part of that require a team of people. It's just not possible to do this as a single person.
Right.
So my responsibility as the attending is to make sure the surgery gets completed properly. Now to do that, I have to be very much involved in the surgery, if not the entire surgery. And if I have a skilled resident or a fellow, somebody that's at the advanced part of their training, I will allow them to participate in the surgery. And that's very common across the country in terms of how residents and fellows are involved. Now, what does that mean? What it means is they may actually put stitches in, they may actually participate in the microsurgical anastomosis, usually done under the supervision of the faculty member or the attending surgeon. This isn't a whole lot different from other settings where there are not residents. In those settings, usually 2 or even 3 faculty members or attending surgeons will perform a DIEP flap surgery. In other settings, sometimes an attending surgeon will perform the surgery with a physician assistant. So there's all kinds of different possibilities. The end of the day, basically the faculty member or the attending surgeon is responsible for the surgery and will be highly involved in the surgery and the post-operative care, but we'll rely on the team to be able to get it done.
So full disclosure with the patient before they go into surgery with what the situation will be.
Absolutely, and I would encourage patients just to open that conversation up.
Yes.
Will there be trainees involved? Occasionally I'll have a patient say, well, I refuse to have surgery if there's going to be residents, and I tell them that's fine, it's their choice, but it won't be possible for me to take care of them because, as I said, that's part of our team, and we have to have everybody on the team involved in order to continue to do our process that we become accustomed to. Most patients are fine with that, and as you explain that to them, they understand that, and I like to explain that to patients because they are likely to see residents, students, fellows involved in their surgery and afterwards during the care. So if they know that ahead of time, I think patients do a lot better with that idea.
Yeah, and I mean in academic setting, I know for my double mastectomy, it was the case. And it was very clear to me that residents, or they would be on board with my care. And in fact, when they came into the room, they always introduced themselves as that. And as an educator, I know firsthand that hands-on experience is what it's all about. So that was
Yeah.
a great explanation. Thank you
Good.
very much.
Thanks. Yeah, and in fact, we need to be able to train the next generation of doctors.
Oh, yeah.
So that's part of life, and it's part of life in an academic medical center.
Yeah, we hope there's a lot of good microsurgeons coming up.
Okay.
Not
Thank
that
you.
we ever want you to leave, but the day will
Thank you.
come, and
That's right.
we need to make sure we've got lots of good ones on board in the future.
Absolutely.
All right. Thank you so much.
Sure.
All right.
Me